Hello and welcome. I'm Roslyn, your clinical nurse. Today I present to you important things to do in pregnancy. Congratulations on your pregnancy and enjoy the video. First thing to do and to think about in pregnancy is to take folic acid and vitamin D. Folic acid reduces your baby's risk of neural tube defects to almost nil. Folic acid is important to take when you're planning a pregnancy and during pregnancy because it helps your baby's nervous system to develop. It is ideal to start taking it 3 months before conception, but if it's too late for that, don't worry, but start taking the recommended daily amount now and continue taking it until the end of the first trimester, that is week 12 of your pregnancy. What is folic acid? Folate in folic acid is a B vitamin which is found in some food. The man-made form is called folic acid and is in supplement form. Evidence shows that taking folic acid supplements reduces the risk of your baby developing spina bifida and other conditions that affect their spine and neural tube. Most people are advised to take 400 micrograms of folic acid each day. Some people may need to take more folic acid. For example, if you or the baby's other parent have had spina bifida or had a previous baby with spina bifida, or the baby's other parent have a family history of neural tube defects, or have diabetes, have a high body mass index, that is BMI, that is over 30, or are taking medication for epilepsy, or are taking antiretroviral medication for HIV. Folic acid in its natural form is called folate. Some foods contain folate naturally. Foods that have folic acid include green leafy vegetables such as broccoli and cabbage, green beans, peas, oranges, chickpeas, and brown rice. Some breakfast cereals, plant-based spreads, and bread have folic acid added. During pregnancy, it's important to try to have a balanced diet that includes a variety of foods. This will help make sure that you and your baby have all the nutrients you need. Vitamin D. This helps your baby develop healthy bones, teeth, and muscles. It helps to regulate the levels of calcium and phosphate in your body. You need this to keep your bones and teeth healthy. Everybody needs vitamin D. It helps us to absorb the right amount of calcium and phosphate. It is especially important in pregnancy as it helps your baby's bones, teeth, kidneys, heart, and nervous system to develop. Our body makes vitamin D from sunlight on our skin, and it is also found in some foods. We make most of our vitamin D for the year when we are out in summer sunlight. This is usually from late March or early April to the end of September. Our bodies make less vitamin D in the shade or in cloudy weather, and we cannot absorb vitamin D through windows. The amount of time you need to spend in the sun to make enough vitamin D is different for everyone. It depends on your skin type, the time of day, and the time of year. It is not known exactly how much time is needed in the sun to make enough vitamin D to meet the body's needs. If you are in the sun, take care to cover up or protect your skin with sunscreen before you start to turn red or burn. You do not need to sunbathe to absorb it, and you only need to uncover your arms and face. If you do not take vitamin D supplement through pregnancy, there is a risk that your child will have soft bones. This can lead to rickets, a disease that affects bone development in children. Some women are more likely to need vitamin D than others. You may have a higher risk of vitamin D deficiency if, for example, you rarely go outside, always cover your skin, use high-factor sunblock, have darker skin, or have a BMI above 30. For anyone within these groups, taking a vitamin D supplement will be very important. But you do not need extra unless you have been diagnosed with a deficiency of vitamin D. It is difficult to get enough vitamin D from foods alone, but there are foods that help your intake. These foods include eggs, oily fish, that is salmon and sardines, for example, red meat, breakfast cereals, fat spreads, and non-dairy milk alternatives. But the amount added to these products can vary and might only be small. The second and the most important thing to do in pregnancy is to stay active. That is being sedentary. Sitting down a lot is not healthy for you or your baby. It puts you at a higher risk of too much weight gain, gestational diabetes, preeclampsia, and varicose veins, and you are more likely to have shortness of breath and lower back pains. If you did exercise before you became pregnant, you can continue at the same level, but listen to your body and slow down when you feel uncomfortable. If you didn't exercise before you became pregnant, you don't have to take up organized exercise classes. The important thing is to be active. Here are some of the ways you can remain active throughout your pregnancy. Take up some easy organized exercise. If you didn't exercise much before getting pregnant, it is still safe and healthy to start now. Begin with 15 minutes of exercise 3 times a week and increase it gradually to 30-minute sessions 4 days a week or every day if you can. Aerobic exercise is a good way to boost your fitness. You could also try swimming, power walking, pregnancy yoga, or indoor cycling or outdoor cycling, taking care not to lose your balance. Walk instead of taking the bus where you can. It may sound obvious, but if there is a regular journey that you do by bus, think about walking instead. Get out and about during your lunch break. Start with a quick stroll and build up to a brisk walk. A break from your desk will be good for you. Climb the stairs instead of getting the lift. Climbing the stairs is a great activity for toning your leg and stomach muscles. If you're on a very high floor, try getting out of the lift a few floors instead. Exercise your arms with everyday activities. Prepare your arm muscles for the workout they will get when your baby arrives, but don't lift anything too heavy. When picking up things like shopping bags, remember to bend at the knees, keep your tummy muscles held in and your back straight. If you have other children, walk them to school, nursery, or toddler group if it's not too far. Walking is a great way to exercise during pregnancy. It has no impact on your joints, doesn't need any special equipment, and you can slow down as your bump gets bigger. Adding walking to part of your normal routine will turn it into an activity that happens without you having to think about it. If you are doing the housework, switch on some music and put lots of energy into it. Housework can be really boring. Make it less of a chore by listening to some music and viewing it as part of your activity program. Hopefully, it will make it seem more enjoyable and useful. Take the dog for an extra walk, if you have one, that is. Do some gardening. Cutting the grass, weeding, and planting are all good ways of getting some exercise with the added boost of vitamin D from the sunshine. Have a dance to your favorite music. It's fun and it's a low-impact way to exercise. The third thing to think about during pregnancy is what you eat. Some foods carry a small risk of infections, such as toxoplasmosis or listeriosis. Others can give you food poisoning, such as salmonella. Others have too much vitamin A or mercury, which can harm your developing baby. Listeria infection is rare, but if you get it, can severely damage your unborn baby. Foods that are more likely to carry listeria include mold-ripened soft cheese and soft blue-veined cheese. There is no risk with hard cheese or processed cheese and unpasteurized milk. Salmonella food poisoning is unlikely to harm your baby, but it can give you a severe bout of diarrhea and vomiting. Foods that are more likely to carry salmonella include unpasteurized milk. Avoid eating raw or partially cooked eggs or food that may contain them, such as mayonnaise. Toxoplasmosis infection is rare, but if you get it, can severely damage your unborn baby. Foods that are more likely to carry the Toxoplasma parasite include uncooked or undercooked ready prepared meals, raw or partially cooked meat, especially poultry, unwashed vegetables and salad, cured or fermented meat. These can be made safe by freezing or cooking before eating. Too much vitamin A can affect your developing baby. Foods that have high doses of vitamin A are liver and liver products, high-dose multivitamin supplements, fish liver oil supplements, or any supplements containing vitamin A, too much mercury, and other pollutants. If you eat the following, you are at risk of eating too much mercury and other substances that may harm your growing baby. Shark, swordfish, or marlin, more than 2 tuna steaks a week, about 140 gram cooked or 170 gram raw each. More than 4 medium-sized cans of tuna a week. More than 2 portions of oily fish a week, such as salmon, trout, mackerel, and herring. Do eat fish within the limits given, though, as it's a good source of nutrition to your baby. The fourth most important thing to do in pregnancy is to monitor the fetal movements. Your fetal movements are a sign that the baby is well. Start monitoring fetal movements at around 24 weeks, and if you notice a reduction in movement, seek help immediately. Fetal movements can be anything from a flutter, kick, swish, or roll. Feeling your baby move is a sign that they are well. The fifth most important thing to do in pregnancy is to sleep on your side in the third trimester. Going to sleep on your back in the third trimester doubles your risk of stillbirth. You may wake up in all sorts of positions during the night, and that's okay. If you go to sleep on your side, you'll be sleeping safely for your baby. Sleep position in the third trimester, that is after 28 weeks, is important because if you're on your back, the combined weight of baby and womb puts pressure on the organs in your body. When sleeping or lying on your back, the baby and womb put pressure on the main blood vessels that supply the uterus, and this can restrict blood flow or oxygen to the baby. Further recent studies have shown that when a woman lies on her back in late pregnancy, compared to lying on side, the baby is less active and has changes in heart rate patterns. This is thought to be due to lower oxygen levels in the baby when the mother lies on her back. The sixth important thing is to remember your mental health. It's natural to feel a bit stressed or anxious when you're pregnant. If you are struggling with these feelings, you may need help. There are no rules about how stressed you must be before talking to your midwife or physician about how you feel. You can talk to a healthcare professional at any time if you have any concerns during pregnancy. The sooner you ask for help, the sooner you can get the right support if you need it. Up to 1 in 5 women develop mental health problems during pregnancy or in the first year after childbirth. Low mood, anxiety, and depression are common. Pregnancy can be a very emotional experience, and it can sometimes be difficult to know whether your feelings are manageable or a sign of something more serious. Trust yourself. You are the best judge of whether your feelings are normal for you. Many people accept pregnancy to be a time full of joy and excitement, but this isn't the case for everyone. Some women who have problems with their mental health in pregnancy or afterwards feel guilty or embarrassed about their feelings. Try to remember that a mental health condition is not a sign of weakness, something that will go away on its own, or that you shouldn't just snap out of it. Just like any physical health problem, mental health conditions need treatment. Some women worry that if they ask for help for their symptoms, people will think that they can't take care of their baby and they will be taken away. Others worry that they haven't felt that instant bond with their mom or newborn baby. These are natural feelings, and any anxiety is understandable. Healthcare professionals work really hard to get moms with mental health problems well so they can look after their children. Don't be afraid to tell your midwife, doctor, or health visitor how you are feeling at any time. You can talk to your midwife or physician at any time if you are worried about your mental health. You should speak to them if you feel low, depressed, or anxious most of the time for more than 2 weeks, if anxiety is making you feel ill with fast heartbeat, fast breathing, sweating, feeling faint, feeling sick and diarrhea, if you have panic attacks, if you have unpleasant thoughts that keep coming back and you can't control them, if you find yourself repeating an action like washing, checking, counting to feel better, if you are so afraid of giving birth that you don't want to go through with it, or if you feel like you can't cope. Find out more about where and when to get support with your mental health. Tell your midwife or health advisor about how you feel in the first step on your road to recovery. They will want to ask you some questions to understand a bit more about what symptoms you have. This will help them talk to you about what treatment and support is available to help you feel better. The most important thing to do as number 7 is to carry your pregnancy notes. It is recommended to carry your antenatal notes everywhere you go, as they contain all your medical and pregnancy history. This is particularly important if you need to go to the maternity unit, especially at short notice, and this is how health professionals will be able to see your history and what has been happening in your pregnancy. Another important thing to do in pregnancy is to take any overseas holidays before 37 weeks. Women have said that the best time in pregnancy for overseas holidays is the middle of pregnancy. Nausea and tiredness are common in the first 12 weeks of pregnancy, and the risk of miscarriage is also higher in the first 3 months. This is not linked to traveling. Traveling in the final months of pregnancy can be tiring and uncomfortable. If you decide to travel later in pregnancy, check your plans with airline. The likelihood of going into labor is higher after 37 weeks, and some airlines will not let you fly. After 28th week of pregnancy, the airline may ask for a letter from your doctor or midwife confirming your due date and that you are not at risk of complications. Check your plans with your travel insurer. Is pregnancy covered in the event of an accident? Bring your maternity notes with you. Long distance travel, that is 5 hours or more, also carries a small risk of deep vein thrombosis, that is DVT or blood clots. So drink plenty of water and try and move around during the flight. The 9th most important thing in pregnancy is to be aware of these symptoms. There are some symptoms that should always be checked with a midwife or doctor, as they could be a sign that the baby is unwell. Bleeding from the vagina, painful urination, sudden, sharp or continuing abdominal pains or cramps. Persistent or severe headache. Swelling in face, hands or legs. Blurred vision, spots in front of your eyes. Itching, especially on hands or feet. Baby's movements slowing down or changing. Excessive or smelly vaginal discharge, or if you think your waters have broken. You should also contact your midwife if you feel that something is wrong with you or the fetus, even if you don't know exactly what it is. It is important to trust your instincts in pregnancy. Thanks for watching. Hope you find this video informative. Be sure to subscribe for more.